Hey everyone, this is Jairo Morales from The Grind Fitness and welcome to my channel. On this channel, you're going to learn how to take care of your body while we do this wonderful sport called Jiu-Jitsu. Everything from joint strength training classes to mobility classes, as well as yoga and many other professionals to teach you what is the best path for you and your Jiu-Jitsu journey. If you haven't already, please do me a favor, hit the subscribe button, hit the bell. You know what to do. Share this with somebody if you think this might help the community to be able to take care of their body for their journey on Jiu-Jitsu. Oos, guys. Hope to see you on the mat. Hey, what's up, guys? It's Jairo from Wellness for Jiu-Jitsu. Today we're going to talk to Brian. Is it Schiff?
Schiff, yes.
Schiff. He's a doctor in physical therapy. Obviously, I've been bringing on a lot of physical therapists recently just because it's all about joint health. Each one has like a particular specialty. Brian here has worked with some athletes. He's worked with MMA guys. But I think it's better if you kind of introduce yourself. Introduce yourself to everybody, sir.
Appreciate it. Yeah, I got about 25 years in the industry now, so it's hard to believe, but kind of becoming a little bit of an old dog. But was a lifelong athlete myself, and did my undergrad work at Ohio State and started in PT there. Then got into some fitness training. I opened my own performance training business in 2000 and did a lot of personal fitness, sports performance work. Did some work with pro soccer. A lot of post-rehab stuff. At that point, I saw that there was a need in the industry to kind of help people get back from injury all the way back to sports. So I was really passionate about that. Sold that business in 2010, moved to Raleigh, North Carolina, and I've kind of been running a sports medicine practice for Raleigh Ortho since then. Really big mix of clientele, anywhere from your youth to professional athletes, a lot of active, fitness enthusiasts. They'll come to our clinic because they want a PT and treatment approach that will help them get back in the game, so to speak.
Yeah, I hear that term a lot. When people say sports medicine, what does that actually mean?
Yeah, it's a really good question. I think a lot of people say they do sports medicine and maybe they do a small fraction of it. I tell our clients that for me, it's anybody who really is trying to do something athletic. I mean, a lot of people automatically assume, oh, I've got to be a collegiate athlete or professional athlete. I mean, I think anybody doing, whether you're doing jiu-jitsu, you're doing triathlons, swimming, tennis, you're an athlete. So to me, that's sports medicine. We work with people, probably mostly 15 to 55. That's probably our sweet spot. We certainly have seniors that come in that have joint replacements and things of that nature. But I mean, really active adults, people that are out there still trying to do competitive activity.
Yeah, I get that what you're trying to say. It's like that people have this, it's like a term that gets like mainstream and then everybody decides to kind of use it as if it's like something like it's the end all.
Yeah.
So I've noticed recently, which is kind of great, that a lot of the medical industry now is like kind of merging with the fitness industry, because I'm a personal trainer by trade. That's how I basically earn my living. The Wellness for Jiu-Jitsu is because I personally I was training, at the time I was training up in New York, and I was training with a lot of young athletes where, they were competitors, where they're in their early 20s and they were complaining about my neck and my shoulder and my back and my hip and my knee. And I'm like, something's not right, dude. Like you shouldn't be like 21, 22 years old. And unless it's like an acute injury, like you shouldn't be having like chronic discomfort all the time just from training, which showed me that like there's something wrong. For me, it turned me on to functional range conditioning, which is a physical therapist that kind of created this whole curriculum for the fitness industry. And that's what's kind of like got me into what I do now, which is mobility work. But technically I'd call it joint strength training. That's what I call it. Because when I try to tell people mobility, they're like, oh, what is that? I'm like, And then when I say joint strength training, it clicks in their mind like, oh, okay, that makes a little bit more sense. And I tell people that's the side effect is actually being more mobile, active range of motion instead of passive range of motion. And I've known now, I've seen it now through social media. I went from like nobody really doing it to like almost everybody is doing some form of like pre-rehab kind of work. But I feel like it's still not gotten to the point where people are like doing it as like a norm yet, which is crazy to me, because I've seen like professional athletes train, and I try to tell my clients that I'm like, if you watch a professional athlete train, like the first like 40 minutes of their program is the most mundane exercises. You know,
Yeah.
they're dorsiflexing their foot like 20 times. They're doing like it's the most mundane stuff, and it's all prep work for them to do their actual sport, whatever their sport is. But for whatever reason, everyone, if they don't feel that burn or that whatever it is when it comes to general fitness, they think they're wasting their time. I'm assuming you've come across that yourself as well, yeah?
Oh yeah. I think probably to your point, mobility is very underrated. I would say mobility and recovery, I see are the two things that lack for a lot of our clients. And, as you get older, and I tell people when I say older, that's a relative term, but let's just say over 30 for the sake of argument, the body really starts to change. You see changes in strength, muscle mass, flexibility, proprioception, balance, all of those things. And so, particularly for your males out there listening, I mean, unless you were just gifted with natural extensibility, we tend to get really tight and stiff. And so, the people that I worry about are people that are trying to produce large amounts of force in short amounts of time. If you don't have good mobility, then usually that leads to injury or can lead to an injury. So, but yeah, the mundane, the prep work, the prehab stuff, I always tell patients and clients, we want to mobilize before we move, which is kind of what you're talking about, getting the body ready, warming it up functionally. How do I get the joints ready for those more multi-joint movements, those explosive type of activities?
Yeah, and I've noticed now. I've been training for a long time, and I mean, I went through like the '90s where it was all like the meatheads. Everybody was all big. Even
Yeah.
myself, I was a meathead myself. And now I've kind of changed my approach a little bit, just because I've learned a lot. I've trained a lot of people. I've seen a lot. I've educated myself, and I've noticed now that it's exactly what you said. It's more about. I found that learning to mobilize yourself first, getting strong at moving yourself first, and then after you get you strong at moving yourself first, then you're going to add external load. And that's
Yeah.
the difficulty that a lot of people, they want to they want to make a shortcut, and they just want to get to the external load. And it's like, dude, like this is a lifestyle. You got to understand that it's not something that you got to, you can't just, it's not a sprint. If you're going to be doing this, you got to be doing this for a long stretch of time. And it's difficult for a lot of people to understand that when it comes to that. Even with the sport, my biggest concern is, I'm already in my 40s now, and and I talk to, some of the jujitsu athletes that are in their 20s, and I get it because I was 20 myself, where they just are like, yeah, whatever, you're just an old man. But in my mind, it's like, yeah, even people that are close to me, that are people that are ex athletes, I'll tell them about some of the stuff, that the pre-rehab stuff that we do, or called mobility, that I do. And then he's just like, oh yeah, it's like, yeah, we'll do the little stretchy thing, blah blah blah. And I'm just like, in my mind, I was like I have to show him, like, dude, this is like college level athletes that are doing the stuff that I'm doing. It's not just some stretchy thing. It's like prep work to make sure that your joint structure is in its optimal strength profile, so that you can maximize your actual athletic ability. But it's very difficult for a lot of people to kind of see that concept, and it's just hard, man. And I find it, I don't know how to sell it to people. I don't know how to like explain it to people and say, hey, listen, I know this feels like almost like, I wouldn't say a waste of time, but it feels so mundane that you're like, how effective is this? And it's like, it is. You just have to be patient and see that long-term effects of it.
Yeah, I think you're right. I mean, it's like when I work with throwing athletes, for example, teaching them an arm care routine, it's the same advice that you're giving. They're very boring, meticulous exercises, but they have to be done on a regular basis so that the whole arm works and so you don't overload it. And I think the other key thing, and you're probably doing this with your clients, is identifying, those kind of areas of asymmetry or areas of, immobility in that chain. And, you're only as strong as your weakest link. And so you got to work at that. The thing about, I think it's frustrating about mobility, flexibility, just kind of moving better is it doesn't happen overnight. It does take consistent effort. And the most flexible people you'll ever see are dancers and gymnasts, right? Well, they work that craft every day. And so that's the hard part. I think people are not patient enough. We don't have a patient society. Everybody wants a quick fix. And I
Right.
think, lifting, doing plyometric, explosive things, you feel that right away. Where the mobility work, it's kind of like a tortoise, right? I mean, it just doesn't kind of get the motor running for most people.
That's it's very, very true. So can you explain to everybody what, because I've now seen, like, I personally use the phrase, but I would like to know, like, the stages. There's pre-rehab, then there's rehab, and then there's post-rehab. Can you kind of like explain the difference between the three?
Sure. I think the pre-rehab or prehab, however you want to label that, get kind of two ways. Some people may know they've got to go into, hopefully not, but you may have, clients that are going to have surgery. So that you could look at it from, we're going to get the bodies physically fit and maximally ready for that procedure prior to. The other way of prehabbing something is to think of it more like a corrective exercise where, hey, I know I've got some imbalances here. I don't have an injury yet, but if I want to prevent an injury, maybe it's a shoulder injury, or maybe I've got a little bit of degenerative change in my kneecap, for example. So people may have problems squatting or doing plyometrics. What can I do to address that? You would look at that as a prehabilitative thing. So that would be something in their program, much to what you've talked about with the mobility. This might be something I program in before I get my lifts going, but it's part of my prehab work. Obviously, you've got your rehab, which is pretty straightforward for people. I mean, whether you've got an overuse condition, a non-operative issue, or you've had surgery, then you've got to go through your rehabilitative programming. And
Do you mind if I interrupt you real quick?
Yeah, go ahead.
What is, because I know what it is, but I'm sure a lot of people don't understand what it is. Explain the overuse criteria.
Yeah.
Overuse.
So this is probably a lot of what I deal with every day with a lot of my clients. Overuse is a loading problem, usually too much volume, too much intensity, or a combination of both with inadequate recovery. And so I talk to people all the time. I think one of the things that scares people about seeing a doctor or even a physical therapist, sometimes they're afraid that the first thing they're going to tell them to do is stop. I want you to work out. I want you to stop doing what you're doing. I never want to tell people to stop. I'd rather say, let's look at your training program. Let's look at these variables. And I tell them, like, it's very important that you understand the rhythm of your body. What are the loading parameters that you're asking it to handle? So how much volume, how much intensity, how much preparation leading up to those things have you put in? A lot of people just make training mistakes. But Ken, to your point, they don't want to do the hard work, the methodical preparatory training that's required of the body based on their own capacity. I mean, so you have things like training history, their age, previous medical problems, natural genetic predispositions to things that they don't even know they have. A lot of these things go into whether a person fails or succeeds in a training plan. And that's why no two people were ever alike. And so basically the overuse happens. Like, you could give them the best training program in the world, but if they don't follow it, if they decide to skip a few steps or add too much load too soon, the body breaks down. And so that's, in a nutshell, that's what an overuse injury would be.
Yeah, I noticed that seems to be very common in jiu-jitsu, because the jiu-jitsu format is everything's in flexion. Your fingers are flexed, your shoulders are flexed, your spine is flexed. Everything is in a flexed position, and it's like they don't do enough counteracting. Like, you're getting better at jiu-jitsu, but you're becoming worse as a human. So it's like,
Yeah.
in other words, they're like, I've seen some of like the older school black belts where they're able to grab onto you and they're like cement, but then they have difficulties like grabbing their keys, or it's like, yeah, they're able to smash you, but then they can't get up off the like a chair. And it's because, yeah, you've gotten really phenomenal at jiu-jitsu, which is great, and then kudos to them for training all their life doing jiu-jitsu. But it's like, man, you can barely walk, my man. Like there's things that you got to do to kind of, and I don't know if that, I'm assuming that that's the overuse. That's what I'm thinking. A lot of the pain profiles they get is basically just overuse from doing the sport of jiu-jitsu. And I'm assuming that would apply to like most sports. I'm assuming from baseball to basketball to tennis.
Mm-hmm.
So if you're right-handed, this motion over and over and over and over and over again, something's gonna go off there for a second.
Yeah. Yeah, the repetition, to your point, the common phrase I'll tell patients sometimes is like, it's like a tire, right? So if you have a set of tires on your automobile, there's so many revolutions, there's so many miles that those tires have. And some of us are, more fortunate than others with certain body parts. That's the thing you'll see. Like you may have clients you train that they always have problems with their shoulder, or somebody else might be their back or their knees. And, I think, I tell people you cannot run from your genetics. So a lot of times, if you look at your parents, brothers, sisters, people that have kind of gone before you, what problems have they had? Those things tend to show up in your life as well. It doesn't mean that you're guaranteed to have them, but I think you have to identify those could be areas of weakness. But, the body will, just like strength training, the body will adapt to what we do. And that's kind of what you're talking about. If your postures are all forward, you're probably going to be folded in if you don't do anything to combat it. Our overhead athletes, these throwers, tennis players, people like that, they're very asymmetrical, right? So you're always doing something in extreme motion on one side. So you see loss of range of motion, you see adaptive things happen. Some of it is unavoidable. I'll give you an example. Strange athlete. I trained an Olympic level fencer, over 10 years ago. And fencing is a very interesting sport. I would say most of us probably don't watch it, but you're always kind of leaping forward on one leg and pushing off the back leg. So you tend to see this very large quadricep on the front because of all the deceleration, right? But then on the backside, you've got this massive calf muscle. So when you would look at this gal, it was really incredible just to take a picture of her lower extremity and see kind of like, it was just kind of imbalanced, and you're like, wow, you just realize
big thigh at the front and then a huge calf.
Totally. And so it's crazy because, you have this Olympic level person, but you just realize how the body will adapt to that stress. It's pretty incredible. So just to kind of finish up our thought. So the post-rehab, because we were talking about prehab, rehab, post-rehab. So that's that transitional phase coming off of your rehab program. And again, I think that's where guys like yourself and where I tried to plug in, in the early 2000s, is I think a lot of people got stuck. They would get basic range of motion, basic strength back, but they weren't really getting that bridge to get them back to that prior level of high fitness activity or sport specific capacity, And so that post rehab is where I think a lot of people, I always try to find good fitness people I can trust or get clients connected. Because I've done both. I've lived in the rehab world and the performance world. I feel like I still live in both, but probably more rehab focused at the moment. But having an understanding of those loading principles we talked about that get people in trouble, and then how do you safely kind of periodize your training and get your clients back, if it's back on the mat, whatever activity they're doing, that's a critical piece. And that's where I think clients, they need help because unfortunately, in my experience, the absence of pain is a green light for people. If they don't have pain, then they're like, I'm good to go, man. Put me back in. I can train full go. I can run or whatever it is that they want to do. And so then what happens is they ramp up too quickly and they end up back in that overuse pattern again because they just ignore those training principles of kind of gradually raising that threshold to activity tolerance.
Yeah, that makes total sense. Yeah, and I've noticed it with the outside of the athlete side, and it drives me bonkers. I've had clients that are on the older spectrum, and they'll do like a cortisone shot. That I'm like, dude, what are you doing? Like you're just masking the pain. Like, yeah, you're gonna feel good, but like it's not making it any better. So in 6 months, you're going to have to go back, except that it's going to be worse because you're basically just know where pain is your body telling you like, hey, something's wrong here. Like you got to pay attention to me, whatever that is. And you're going to mask it with some drug to, like, I understand if it's excruciating and you can't sleep and you can't function, totally get that. But just to do it because like there's something off there. But like you said, unfortunately you can't control that. Like some people are just, they're like, yeah, but that's what I want to do. I'm like, all right. I mean, what are you going to do? You just stay, okay.
Yeah. It's interesting. You bring up cortisone. People this is the other thing. I mean, I focus a lot on like the mental part of like recovery for people because we didn't learn a lot about that when I was in PT school, but I focus a lot on it now. The power of the mind and body connections are really important. But what I find is people have assumptions about what something's going to do for them. So they talk to their neighbor and their neighbor's like, oh yeah, man, I had that rotator cuff thing. I got an injection, cleared it right up. So they go in and they think that's the magic answer. And sometimes they come out and it doesn't help them at all, or it only helps them a little bit. And cortisone weakens tensile structures. I tell people this all the time. If you're doing like really heavy weight training and you're going to get a cortisone shot, I mean, man, you start to worry about, rupture your pec. Are you going to now tear your rotator cuff? So cortisone, it's not a magic sauce for most people. And to your point, I think people just want the pain to go away so they can keep training pain-free. And sometimes that just really leads them down the road of disaster or disappointment.
Dark path. It just gets worse. It's like, it's like you have credit card debt and you get another credit card. You're like, what? It's like, dude, take care of the first credit card debt before you go get another credit card.
Yeah.
Oh man.
For sure.
So I like the fact that, like I said, it's gaining momentum. At least I was in this. I took a course this past weekend, and I didn't even know that you guys don't learn much soft tissue work in physical therapy. Like actually, like when you actually take it, there's not much. Not that there's not zero, but it's not much. And I was like, wow. And I like the fact that now everything's becoming a little bit more holistic. So I feel like the Fufi, the yoga people with the mind, body, and spirit, with the breathing and the meditation, is now ingrained a little bit with the fitness. The physical therapies now, and the chiropractors are now doing a little bit more what the personal trainers are doing. So it's kind of cool to watch, like everything's kind of like overlapping a little bit and kind of coming together a little bit more holistically. But again, it's like, it's only small portions of the overall like theme is getting there, but it hasn't like trickled down to like the masses yet. I think it has something. It's this. I think it's a combination of like insurance and basically people paying for it. So from my experience, it's more like, oh, I can't afford a personal trainer, so I'm going to go to blah 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 to do this, or I have a physical therapist, and the physical therapist recommends me to go do this, but then I can't afford that kind of thing, type of thing, and then it's like there's this weird disconnect that's happening because, and I think it's money related, where it's like it's only like available for like the people that actually have a lot of disposable income, and that kind of sucks because it's like it's like I know it, and it's like it's unfortunate that like I said, the physical therapist is like, okay, you outsource to a massage therapist, but then it's like, does the massage therapist know what a physical therapist knows? No, not really. They know a lot, but not really. And it's like the combination of the two is a much better like path. It just hasn't actually kind of happened yet.
Yeah. I mean, I'm huge on collaboration. I think unfortunately we still have work to be done on a lot of those fences. I think some trainers don't like PTs, some PTs don't like trainers. Usually what I find is people that feel threatened probably are more just insecure about their own knowledge base or their own ability to work with people. I want my clients to feel better. And if it takes an acupuncturist, a chiropractor, a massage therapist with me to make that happen, then so be it. I think the goal at the end of the day is to serve your client and help them be their physical and mental best. And so we just all should feel like we can do that. Everybody has a role, I guess.
You said you've worked with some MMA people. What are the feedback? Like, what's the injuries that you've seen, and what do you feel like they get some of the results for them to do? Because MMA guys are very committed to their sport. So
Mm-hmm.
they'll do anything. They'll do anything to get back to it.
Yeah, the most common things that I see are shoulders and knees. I've had a couple guys that have had labral tears, kind of cartilage up in the top of the shoulder. I've had some
Yep.
rotator cuff. Those are two common ones that I've rehabbed from some guys. And then on the knee end of things, it's usually been the ACL. Unfortunately, I've had two in the last 2 years that have had ACL tears. One actually, kind of interestingly enough, both of them suffered an ACL tear doing something else, but that's what they love to do, is do the jiu-jitsu MMA work. But you can't do that if your ACL doesn't work. You don't have the stability or the balance to kind of pivot and do the work. And so those are probably the more common ones that we see that require like extensive rehabilitation. On the non-operative side, sometimes you get some tweaks. Maybe a guy subluxes his shoulder, kind of gets in a strange position on the mat when they're down, and the shoulder slides out. So we've had some of those as well.
Yeah, in the jiu-jitsu world, I've seen upper back, knees, and shoulders is basically what it is.
Yeah, those are the most common ones.
And then jiu-jitsu fingers, which I'm big on that. Like even me, but I do therapy. Like you can even see my hands.
Yeah.
And I do quite a bit of therapy on my own fingers. Like I don't wear. A lot of the jiu-jitsu guys wear tape. I don't wear tape because it's like I know how to walk. Why am I going to wear it with a crutch? If I have trouble walking, I got to learn how to walk. So that's my mentality. Of course, none of the jiu-jitsu athletes agree with me, but I'm like, yeah, whatever. They're young and they look at that. I just look at it like I'm just worried about my hand, because if I tape it, I'm masking the discomfort, and I'm exacerbating the imbalance that I have in my fingers. And in 10 years from now, my finger is going to look sideways, and I'm not going to be able to curl my own finger because I've taped it so much. The knees thing, definitely what's the trend now, and the guy got really popular was the knees over toes guy.
Yep.
So the knees over toes guy. I've seen the program. It's super, super basic. It's like basic rehab stuff. And it makes sense because, again, I go back to the extreme flexion. Like when we're doing a lot of the jiu-jitsu positions, our knee is like massively flexed, and then we ask for tibial rotation. You think that might cause some pain? Possibly.
Yep.
Yep. And that's why the knees over toes guy is basically such a fan favorite at least in the jiu-jitsu. Well, I'm sure in other sports as well, but at least in the jiu-jitsu world, is because his thing is massive knee flexion under load. So if you're able to do massive knee flexion under load when you're doing jiu-jitsu, you're more likely to have discomfort. You're stronger in that position. For the lower back, I've seen lower back. I think it's just extreme hip flexion, and basically people don't have enough rotation in the hip, enough anterior posterior tilt, and then they're upside down in jiu-jitsu, and they're wondering why their back hurts. Well, how do you think you got into that position?
Yeah. Yeah, I think one of the things I tell people, it's just kind of touch on the low back a little bit in the training things. Your psoas muscle attaches to the lumbar spine. So that, that iliopsoas, it comes off of L4, L5, S1, 2, 3, and then it kind of comes down to the femur. So I tell people, particularly people that have had any history of back injury, when you do long lever abdominal training, so like hanging leg raises or anything kind of like that, you just really have to be aware that there can be a lot of shear force on that lumbar spine. So just kind of an awareness of that can be important for injury prevention, like we were kind of talking about the prehab stuff, and just knowing that maybe not all forms of training are the same, and you may have to modify that.
Yeah, 100%. What the biggest thing that I found, especially as I've gotten older now, maybe not so much when I was younger, but training for muscle hypertrophy is bad for jiu-jitsu. Like you got to actually train for power and neuromuscular strength, and not for muscle hypertrophy, because your muscles in a weakened state, and basically jiu-jitsu is joint breaking. So if that's how I tore a little bit of my pec. I basically didn't know any better, and I lifting like I normally lift, and then I go do jiu-jitsu, and through no fault of, at the time I was also an idiot at the time too, because I was a white belt at the time, and the brown belt was getting like an armbar, and because my pec was in a weakened state because it was sore, it basically got damaged because of it. And I try to tell people like, hey, you got to adjust how you lift for jiu-jitsu, because you shouldn't be excessively sore, because now your joint structure is at a disadvantage, because the muscle is there to support the joint structure. So if your muscle has a bunch of micro trauma on it because you're trying to get big muscles, don't get me wrong, big muscles help, but in essence, you're basically stressing, by de facto, you're weakening the joint by stressing the muscle so much. Am I off to think that, or what do you think?
No, I mean, I think I think it kind of like depends on. I mean, kind of what you're saying is, I think you want to train for functional application, and so one of the things with the shoulder joint, particularly, I mean, for jujitsu and fighting, the more strength throughout the range of motion you're going to have is probably going to be helpful, right? I mean, you're going to find yourself in positions grappling and doing things that are abnormal, right? I mean, for just being honest, shoulder has all that freedom of movement. So I think like you said, traditional strength training is probably not as applicable. I think you're going to have to train multiple angles. So like in my thought as a strength coach, training somebody that would be doing that, it does have to be different. I mean, it's, you got to train. I always tell those athletes, like, you've got to train in an open chain, but you've got to be able to do a lot of closed chain training where, if you're down on the mat, you got to be able to control yourself, and can you produce power, or more importantly, I talk to athletes about, can you resist, motion, right? Because somebody's trying to impose their will or move you a certain way. And that's really important too.
Yeah, and I try to explain people that it's a lot of, I feel like, so one of the greatest grapplers in the world right now is this guy named Gordon Ryan. And one of the things, they were interviewing his coach, and they said one of the things that makes him gifted is his ability to do isometric contractions over a long period of time.
Yeah.
So, and I tell people, I'm like I know that obviously muscle hypertrophy, eccentric, concentric motions, that's all great. But really, jiu-jitsu, it's grappling just in general is isometric strength. It's like, are you actually working that on a consistent basis? Because it's a different energy cycle. It's different. Elevates the heart rate higher. There's a lot of things to that, and a lot of people don't understand that concept, and it's difficult to imply and to implement. But it's one of those things. It's like, man, exactly what you said. It's like you got to be sport specific. You're not going to need isometric contractions for basketball, but you definitely need it for grappling. So the workout that you see for basketball is not going to be the same for jiu-jitsu. The workout for, and the thing is, a lot of the jiu-jitsu guys, come from fitness backgrounds, but they come from like gym backgrounds, CrossFit and that type of thing. I'm like, yeah, that's great, and it makes you very strong. But that shit doesn't really apply to jiu-jitsu. It's a totally different animal. Like, you can continue doing it, but you're never going to maximize your strength profile for grappling if you continue with that type of program. I'm not saying that there's anything wrong with that program, but that's for vanity. That's for looking sexy in the mirror. But if you want to look sexy on the mat, you gotta adjust how how you train.
Well, yeah, and I mean, I always think the interesting thing too is, I always tell people, you can't judge the strength of a person by their appearance. I mean, some people look like they would be really, really strong, right? Maybe they're naturally cut, maybe their hypertrophy profile is more mesomorphic, so to speak. But I mean, if you've ever done any wrestling and wrestled different people, sometimes like you look at somebody and you think you're going to take them, right? It's almost like arm wrestling. I'm going to take you. And then all of a sudden you're like, whoa, man, this person blew me away, how strong they were. And, you know, the isometric piece, it's interesting. It's also good for tendon strengthening as well. But it's boring. People don't like doing isometric stuff. I mean, you know, you think about like, you know, your gym teacher uses it to punish you, right? Or your basketball coach, let's do some wall sits for a while, or let's just do planks, man. Those are isometrics. People hate that stuff. Um, but you know, I mean, I tell people all the time, and it's so totally true for like MMA stuff. Like you do have to be able to resist movement or endurance, right? Like totally endurance. Like if you can endure somebody trying to do something, or you can resist it for a longer period of time, it can be effective. So there's a lot of training nuances. The other thing I really believe in my career, just doing training, is there's no one program that's the best
No.
program. And that's why sometimes I kind of chuckle to myself when people are like, oh, you're going to steal my program, or you're going to do this. It's like, come on, man. Like the best people in the world at what we do, they just have an ability to synthesize information and then program it for their clients that are specific to each person. And I think that's the thing. You got to have the ability to kind of, can't get caught up in your own ego. You learn from lots of different people. And then you kind of look at each client and say, well, I think here's your strengths, here's your weaknesses. What are your goals, and how do we put that together?
Yeah, 100%, man. I agree with you like 1,000% with that. It's just people get caught up in that type of like the ego process where you're like, it's like, dude, like it's the more information you have, the more it gives you to be able to customize a program for each individual person. So in essence, like I still do stuff all the time. Like right now I started doing Indian clubs, and I was just like, oh, I was like, hey, this is actually pretty good for jiu-jitsu. I was like in my mind as I was doing it, I was like, yeah, it takes a little while, a little coordination, but I'm like, basically I'm just doing a bunch of cars. I'm just doing a bunch of wrist rotations. I'm doing a bunch of elbow rotations. I'm like, interesting. I was like, I never would have thought this would be actually beneficial for jiu-jitsu. So there's all kinds of things. It's like you got to be open to all kinds of different programs and then adjust. And then, like you said, it's age is also a factor. The way you train like a teenager is going to be different than the way you train a young 20-year-old, and the way you train a 30-year-old, and the way you train a 40-year-old. And the program is going to adjust. The framework might be the same. In other words, like, okay, these are the basic fundamentals that you need to kind of somewhat follow. Some of the preventative stuff that we're going to do and blah, 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 blah. But in all sincerity, so you just got to custom who's your audience. It's like, you know, and I think that works across every industry. It's like comedy, you know, a joke that you do in North Carolina may not hit the same in California. And the joke that you do in California may not hit the same in New York. It doesn't mean the joke's not funny. It's just it's know your audience.
Yeah, for sure.
Man. Anyways, it was a pleasure chatting with you. How do people find you? And I found you through LinkedIn, but I'm assuming you have your own practice. Do you work out of a practice?
Yeah, I work out of a practice. I mean, you can get to me. Obviously, you can get to me on my personal website, brianschiff.com. That's one easy way. You can connect with me on Twitter at Brian Schiff, through LinkedIn. Yeah, and if you're looking for actual physical therapy, you can connect with me through our practice. You know, it's the Raleigh Orthopedic Performance Center. Website is APC, 3 letters, apcraleigh.com. And then you can find our sports practice there. So, yeah, I mean, I love talking shop. So appreciate you having me on today.
Yeah, man. Listen, at the end of the day, I learn from dialogues from every person that I walk across, you know, and look, I feel like I can work with athletes, but you are already working with athletes. You've had 20 plus years of actually working with athletes. So any of the guys that are watching this that are athletes, you know, listen, guys, the whole idea is reach out to this guy, you know, talk to him, do an online program with him, that type of setup where you may not have to actually go and physically go there, but I'm sure that he has some type of system where he's going to evaluate you and figure out what's going on. And then the benefit to you is that if he has a program that you're following and then you actually get hurt in some fashion because you're a competitor, guess who you can call? The guy that's also a physical therapist. You know, so that's a benefit for you. You know, it's like just keep that in mind, guys. The whole idea is, and the reason why I'm bringing you all these interviews is so that you guys have resources, because I don't know everything. I feel like I know a lot, but at the end of the day, I'm always going to outsource. That's why I've had functional medicine doctors on here. So I have had physical therapists on here, because, you know, the more, again, that all I care about is you guys not feeling pain and maximizing your results. Not feeling pain, maximizing your results. That's all it is. You want to. The jiu-jitsu is a marathon. You know, it takes 10 years to get a black belt. If you're not committed to 10 years, then basically you're not that you're wasting your time, but you're not going to get the results that you want. And so if I can help you guys refer people to people like Brian, then even better, man. At the end of the day, if he's going to be able to help you do it. All right, guys.
Good stuff.
Thank you for tuning in, and I will see you on the other side, guys.